Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our genetics series, a special collaboration between the Blum Center and the Center for Genomic Medicine at Mass General. Before we get started, I just want to go through a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're on listen-only mode. Everyone have mutes to hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We have time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all. Joining us today, we have Kelsey Reynolds. Kelsey has her master's degree in genetic counseling from the Rutgers University. She is one of the 5 reproductive genetic counselors in the OB/GYN department at Mass General Hospital. She also sees patients at the MGH Fertility Center. She joins us today to give a talk on carrier screening recommendations for pregnant and family planning individuals. So please join me in welcoming Kelsey.
Thank you, Amy. It's nice to be with everyone today, and thank you for organizing this with the center. We're really excited to be able to share some information and a resource for carrier screening for many different patients. And as Amy said, we'll be talking today specifically about carrier screening and recommendations for pregnant and family planning individuals. So just to start off, I do not have any conflicts of interest to disclose today. I did want to mention just some brief terminology that we plan to use today. We know that there are many different ways that families are able to make family structures, both whether that's a natural pregnancy or with working with our fertility center. For the purpose of this conversation today, we'll be using terminology like sperm contributor and egg contributor, but that may also be interchanged with biological father and biological mother. Some objectives that we have for our presentation today would really just be to go over some background of genetics and carrier screening, along with touching on its intended purposes. We'll then go over how family history may impact screening and analyze pros and cons of carrier screening. Really, our end goal for this presentation today is for families and patients to feel equipped with the necessary information to make informed decisions about carrier screening and whether it's a test that would be beneficial for you personally or for your family as a whole. So starting out, I'm just going to go through some general background, not only about carrier screening, but also about background genetics and some things that might feel a little bit like high school biology for a few minutes. This will be pretty brief, but I just want to make sure that everyone that's joining us for the visit or presentation today, along with joining us in the future, is at a similar page in terms of background information to really understand carrier screening completely. So to start, we know that genetic syndromes can occur in many different ways. Some genetic conditions are inherited from parents, which is really the focus of carrier screening and its technology. But we also know that genetic syndromes can occur completely at random. Although that's not the topic of today's conversation, it is something to consider when planning families or pregnant, as there is different testing that can be pursued for those random genetic conditions. Genetic conditions can also be passed down from family members that are thought to be completely healthy. So while there are forms of genetic conditions that can be passed down from individuals that know that they have a genetic condition themselves, When we think of carrier screening, we're really focused on testing individuals that are healthy without a known condition that they may have, unless they did this type of expanded testing. And while some families know that they have a risk of a specific condition, maybe because they have a sibling or a cousin affected with something like cystic fibrosis or one of the hundreds of conditions that exist, many families, and truly most families that have a child with one of these inherited genetic conditions, do not have any other family members affected, which really highlights the importance of carrier screening and this type of testing. Carrier screening itself is a test that screens individuals for conditions that can potentially be passed down to children. Even if an individual is a carrier of a genetic condition, and even if their partner is also a carrier, which we'll show in a few slides to help explain in a bit more detail, that does not mean that you would have a child that's affected, but it does increase your risk, which is why we say it's a potential risk and not a guaranteed risk that you would have a child affected. Typically, as a carrier, individuals do not have any impact to their own health. Although, as we learn more and screen for more conditions, we are learning that some conditions as a carrier, individuals may have more mild symptoms or some different health concerns that we may want to discuss or talk to you about if you were to do this screening. We know that there are hundreds of labs that offer carrier screening, and with that, that means that there's hundreds of panels that exist. And these panels can really vary quite widely in terms of what conditions they test for and how many conditions they test for. And so that's something that we'll discuss a bit later as well. But really the goal of this conversation is to help patients decide how much testing would be best for them and their unique families. What's important to note is that the goal of carrier screenings is really to identify conditions that are well known, so we can give information to families about what that specific syndrome is and what symptoms they would see in a child. They should be childhood onset, so we're not screening for conditions that are diagnosed later on in adulthood or later on in life. And they're generally thought to be quite severe. So the definition of severe can definitely vary depending on interpretation of family members when you view a certain condition. And so that is also part of the reason that these panels can vary so widely. I think it's really important, though, to note that even if you are offered screening by a provider, it is never required. It is always completely optional. And there are limitations to all of the panels that are on the market today and really all options that exist. And so we'll review all of that in more detail in a bit. So this is the part that I said might remind us a little bit of high school biology, but again, just making sure that we're on the same page for how conditions can be passed down. Every single individual is made up of millions of cells. And inside all of these cells, we have 46 chromosomes, or 23 chromosome pairs, one copy of each inherited from a biological mother, and one copy of each inherited from a biological father. On all of these chromosomes, we have thousands of genes, and our genes are really our body's instructions. So some genes tell our body how to make certain proteins. Other genes may play a role in helping our heart function. And all of these genes are very important, but have different effects on an individual. Because we have 2 copies of each chromosome from the biological parents, we have, generally speaking, 2 copies of each of our genes as well. So we have 1 copy of each gene, again, from the egg contributor or biological mother, and 1 copy of each gene from a sperm contributor or biological father. For the most part, both copies of these genes should be working properly, but we know that we're all carriers of certain genetic conditions. And as a carrier, what that means is that you have 1 working copy of a gene and 1 non-working copy of that gene. Because we have at least 1 copy of the gene working, we would not be expected again to have symptoms of these conditions. However, there can be a concern for a child to have a genetic condition that's inherited in a recessive manner if both parents, the biological mother and biological father, have the same gene copy that is not working, or a gene that causes the same condition that is not working properly. And that's really what makes someone an individual carrier or a carrier couple. So this diagram really walks through the risks of a carrier couple. So for this diagram, the biological father or sperm contributor has a non-working copy of a gene indicated in this darker blue segment of the chromosome, as does the biological mother or egg contributor. When we pass down our chromosomes and our genetic information, it's passed down at random in our sperm and in our eggs. So we have no control over whether a sperm or egg cell has a working copy of a gene or a non-working copy of a gene if we were carriers of a genetic condition. This leads to a couple, if they are carriers of the same condition, having the potential to pass down both working copies of their gene. I'm sorry, I believe I said that it was the dark blue that was the carrier. It's actually indicated by light blue in this diagram. So the dark blue individuals that are, individuals that are having their genes passed down are two working copies of the gene. And that would happen 25% of the time when a carrier mother and carrier father have a child together. The other possibility is that a carrier father may pass down his working copy, whereas a carrier mother passes on her non-working copy, or vice versa. And so when individuals are a carrier couple, there's a 50% chance that they could have a carrier son or daughter, just like they are themselves. All of these individuals, whether you are completely unaffected or carriers, again, would not be expected to have health concerns related to the condition. However, there would be a 25% chance that both the biological father and biological mother could pass down their non-working copy of the gene, and that would mean that a child would have a genetic syndrome. Other forms of conditions that can be passed down can actually come just from a carrier mother or egg contributor. And that's because women have often two copies of their X chromosomes, whereas males have one X and one Y, your defined male as birth. If an individual has a gene that's not working correctly on their X chromosome, then they have two copies of their X chromosomes, they are unlikely to have very significant symptoms of that condition. But when they go on to have children, they have the potential to pass on their non-working copy of that gene on their X chromosome to an XY child. And because that child does not have their backup copy of that gene on the X chromosome, they may have more significant features of that genetic condition. As opposed to if an XX female passed on that non-working copy to an XX daughter, that daughter would be expected to be a carrier by definition. What is important to note is as we learn more about these X-linked conditions, we are learning that females may actually have symptoms more frequently than symptoms of other types of conditions. So anytime someone has testing and is found to be a carrier of an X-linked condition, it is really important to discuss that with your doctor, along with discussing monitoring for your own personal health, not just for future generations. So that was kind of the general background and a brief biology background as well. Now moving on to more specifics for carrier screening and what to really consider with carrier screening itself. This is a quote from ACOG, or the American College of Obstetrics and Gynecology. And I think this quote really highlights our general goal and reasons that we think and offer carrier screening to families. So the goal of genetic screening is to give meaningful information that can be potentially used to guide pregnancy or pregnancy planning. And this way that we're guiding pregnancies is very personal. So we could give the same information to multiple different families, and they would use that information differently. There's never a right or a wrong way to use carrier screening information, but it can be implemented to help families make really important reproductive decisions. Over time, carrier screening has really changed and evolved. So years ago, there was very limited options for conditions that we were able to test and screen families for. So even just a handful of years ago, many individuals only had screening for the three most common rare conditions that exist in the general population. So that would be something like cystic fibrosis, which affects the lungs, spinal muscular atrophy, which affects muscles, and Fragile X, which affects intellectual abilities and is the most common cause of autism by a single gene. As we learned more, we realized that some populations or some groups were at a higher risk to be positive carriers for certain conditions. And that was really important and meaningful because we were able to add additional conditions on for some individuals based on their ancestry or the areas that their family came from. While this was really beneficial and allowed us to make more targeted testing, it still left a really big gap in the screening. And it wasn't equitable because not everyone knows exactly what ancestry their family has or really comes from, where they might come from. And we know that regardless of ancestry, there's the chance for people to be carriers of conditions that may fall in certain ancestry groups or outside of those groups. And so now in 2024, we have this option called expanded carrier screening, which encompasses those limited options along with ancestry-based testing, but really expands upon that and offers screening for potentially hundreds of different conditions, and has technology that can fully sequence or read the genes instead of just looking at a few common variants that we see in certain populations or ancestry groups. With expanded carrier screening, though, as I've mentioned, panels really can vary widely. And so there are a few things that we try to consider when we decide what we should be screening for or what types of conditions to include in these panels. But not every lab is the exact same, even when we try to follow those guidelines. So this diagram really just emphasizes the numerous panels that exist, and it's really just a few puzzle pieces of the larger picture. But as you can see, there are some panels that range from just 14 conditions to panels that range all the way up to close to 800 conditions. When we think of these panels and what panels really should include, we hope to be screening for conditions that have a significant impact in individuals' health early on in life. And when we say a significant impact, these might be conditions that can affect cognitive ability, so cause things like intellectual disabilities or developmental delays. They may also have physical impacts on children. Sometimes those are things that can be seen as early as an ultrasound during pregnancy, like if there's a difference of the baby's heart as that's developing. But other times it may not be something that we can see on ultrasound, but there can be physical differences like how their muscles are working that are seen shortly after birth. And these are generally conditions that require medical intervention and may either be managed and treatable, or things that, while not completely treatable, may benefit from other types of care like palliative care or things of that nature. Again, as I highlighted earlier, we hope that these would be well-defined syndromes. So truly, there are thousands of different genetic conditions that exist. Some genetic conditions we have a great deal of information about and can give information to families about symptoms that are associated with the condition, what to expect in terms of ages of onset, and things of that nature. And that's really what we hope to be able to provide to families if they are found to be a carrier couple or a carrier of a genetic condition. Some recommendations say that there should be a carrier frequency or a chance that someone is a carrier of close to a 1% chance. Although this is one point that really does vary by lab. So as we get into larger panels, close to 800 genes, the carrier frequency of some of those conditions is much lower, or the chance that someone could be positive is much smaller. We also, of course, would want prenatal diagnostic options to be available, which I'll discuss a bit briefly later on. But what that means is that if we are giving someone a test results or a chance that they could have a child affected, we want those families to be able to use that information during the pregnancy if they desired to, by learning if their pregnancy had that condition or was unaffected. And due to differences in technology, that's not always possible for all conditions that exist, which is really why we can't screen for every single type of inherited genetic condition. This slide just highlights really the ranges of conditions that might be included on different carrier screening panels. While the panels all vary and the conditions that they test for vary, oftentimes the goals of those panels are similar. So there are conditions on carrier screening that are very severe and unfortunately remain untreatable, meaning that they're life-limiting. So a few examples of that would be a condition called autosomal recessive polycystic kidney disease, which sometimes we can see early on an ultrasound because the kidneys are just not developing like they should. There are other conditions that are quite severe, but they might have supportive therapies or interventions that we can provide to families. And those interventions may be more beneficial if they're offered early on. So for example, Fragile X syndrome, which causes intellectual disabilities. While it's not something that we have a treatment for that could cure the condition, we know that those children benefit from things like early intervention therapies. And if we know that a child has a risk of having Fragile X syndrome, either from the pregnancy or from testing later on during their early life, we can potentially offer that therapy earlier to them before they even show signs of those intellectual differences. The next group of conditions that exist on these panels are conditions that can be quite severe, but we have really good treatments for. So there's a condition called PKU, which can be quite severe if it goes untreated, but we have abilities to completely reduce and eliminate the symptoms that are associated with the condition by making changes to those babies' diets early on in life. In this middle section and this dropdown, I've highlighted a handful of conditions that kind of fall in the middle. So as genetic testing has grown and research has grown, there's been the development of many new gene therapies, which can help target and treat some of these genetic conditions. And so conditions that 5 to 10 years ago were really quite severe and only had supportive therapies available are beginning to move towards the realm of conditions that are treatable or even highly treatable, which is really exciting for us. And it's a way that really highlights one of the benefits of carrier screening, in that more and more conditions are becoming things that can be treated. And sometimes the prognosis is much better if we are able to treat those early on. And then the last group of conditions that I would include are conditions that really have a range of severities. So things like biotinidase deficiency, which are fairly common for our patients to come back as carriers of, because many individuals have a very mild variant in the gene. However, there are also forms of this condition that are quite severe. And so that's why it is still included on carrier screening, although many patients have a more mild form. For the next section, I wanted to walk through some pre-test considerations or some things that we would hope either you talked with a bit more with your provider or think of before pursuing carrier screening. Starting off with a common question of like, is carrier screening right for me, or who really should benefit from carrier screening? So we would offer and oftentimes recommend carrier screening for individuals that are planning a pregnancy. That can be someone that is planning a pregnancy 6 months to a year from now, planning to have a pregnancy naturally, or planning to work with our fertility center. I love when patients are able to access carrier screening prior to a pregnancy because that really is the time where we have the most reproductive options available if a couple was found to be a carrier couple. However, there really is no timeline or restrictions for carrier screening, and it can still be very informative for individuals when they are pregnant. Something to think of or know and keep in the back of your mind for anyone that is using a sperm or egg donor is that most clinics in America and sperm and egg banks do require their donors to have carrier screening. And based on a donor's carrier screening results, there may be the indication for you yourself to do screening as well, depending on what they were positive for or if you've had testing for that. And carrier screening really should be considered for individuals regardless of their family history. So if we know that we have a family history of a genetic condition, we may recommend specific testing, but even without that family history, testing should still be considered. Carrier screening is not for individuals that have specific concerns of adult onset conditions. There are different providers at Mass General and at many different institutions that offer screening for adult onset conditions. So individuals that maybe have a family history of many individuals with cancer may benefit from working with our cancer center at Mass General and doing cancer screening. That's similar to individuals with histories of neurological concerns or cardiovascular health concerns. But that is really not the intended purpose of carrier screening itself. And that's true of individuals that either have that family history or have symptoms directly related to the condition that they want to test for. And then additionally, carrier screening is not for children, and that's regardless of your own results. So for individuals that do carrier screening, maybe in their second or third pregnancy and already have little ones at home, they may wonder, like, should we test our child for the condition that we came back as a carrier of? And if it is just one individual in the couple, whether that's the egg contributor or the sperm contributor, and we are not concerned that the child themselves may have the condition, we would not recommend doing carrier screening for that child. But it's something that you can remember and tell them about later on in life because they may want to have a child of their own. Another common question that patients have is, how does family history impact testing? So, as I briefly mentioned earlier, if someone has a known family history of a genetic condition, or if they have a sibling that did carrier screening and is found to be positive, that may be a reason that you want to take a closer look at the test that you're ordering or the lab that you're working with and make sure that the specific condition of concern is being tested for. We also may recommend larger screening options for families or couples that are consanguineous. And that just means that families or couples that have some type of blood relationship to one another may be at a slightly higher risk to be carriers of the same thing, and therefore may want a larger panel. And then we always recommend asking family members. So we would say first or second degree relatives are always most informative, like your siblings or maybe your close aunts and uncles. If they have any history of birth differences, so people being born with things like a hole in their heart, cleft lip, or things that required surgery really early on in life. It's also useful to know if individuals or family members have a history of intellectual differences. sudden infant death, or if many individuals in the family have similar severe onset childhood conditions. I would really say if the answer is yes for any of these points, it may be really helpful to meet with a genetic counselor to discuss testing as opposed to doing routine testing offered by most providers, because there might be more specialized testing that we recommend with this history. But again, I think the common highlight that I really want to drill home is that regardless of family history, regardless of how healthy everyone in the family may be, most individuals do not have a family history of a condition when they have a child affected, and they generally would still qualify for this expanded carrier screening type of testing. There are, of course, though, still risks and limitations of carrier screening that we should consider. And the biggest thing that we would always mention is that regardless of the carrier screening panel that someone does and how large that panel may be, it is still possible for a child to be born with a genetic condition. That is true of conditions that happen at random, of course, because carrier screening does not screen for those. But it also can be true of conditions that we test for, because no lab knows everything or has the ability to detect every type of change in a gene, unfortunately. And so sometimes, even if someone had negative carrier screening, while it is quite rare, they could still have a child with a condition that they were tested for previously. There is also the potential to learn unexpected information from carrier screening about your own health. So there are forms of genetic conditions that can be quite severe in children, but also the same gene may have a form of a condition that is more mild and diagnosed more frequently in adults. So one side of unexpected information is that you yourself could learn that you have a condition. The other side of unexpected information is that some carriers may have different symptoms or be at risk to develop different symptoms later on in life. And with all of these risks associated with either you being diagnosed with a condition or having some symptoms of a genetic condition, it's important to kind of know what protections are in place. And so there is a law called GINA, the Genetic Information Non-Discrimination Act, which went into law in 2008, which does protect individuals with genetic conditions from discrimination by employers and health insurance companies. However, it does not protect against everything, unfortunately, and so there are not protections for things like life insurance. What I would also say is the chance of learning unexpected information about your own health is quite rare, but it's something that is important to consider and at least be aware of when you do this testing. Really, when we think of the benefits of screening, screening allows individuals and families to be more empowered in their reproductive decisions. Whether that is on the preconception side and having the ability to do testing before getting pregnant, or whether it's during a pregnancy and deciding to do testing of that pregnancy to make important decisions for the family. This is information that can be quite beneficial, especially if there was a couple that is a carrier of the same condition. Having this information early or during a pregnancy can help us to identify support and resources for families. So it can help us to connect with doctors, to make plans for delivery if a child is expected to have a condition at birth. We can also connect to many different resources. Sometimes there are resources or support groups for this specific condition themselves. Sometimes there are even support groups at Mass General. So it's a really important way for us to be able to get people plugged in with the right resources and have time to prepare. With carrier screening, it gives us the option to do testing during a pregnancy or shortly after birth if a couple is expected to or is found to be carriers of the same thing. This type of testing is, again, never required, but it is a useful option for families to know about and think about throughout their pregnancy, or just be able to test a child right when they're born. Another important piece of carrier screening is that it really can reduce a diagnostic odyssey. So, with these rare genetic conditions, unfortunately, because of how rare they are, they're not something that is well known by all providers when they do come up and are found when we do find a child to be affected with them. Because they are quite rare and their symptoms can all vary, some studies have shown that children with genetic conditions can have a diagnostic odyssey of up to 7 years, meaning it can take them 7 years to reach a diagnosis. If we know that a couple is a carrier of a specific condition, we can drastically reduce that diagnostic odyssey again by testing the baby during the pregnancy or right after birth. And I've already touched on briefly ways that we can modify care plans by connecting to doctors and changing pregnancy plans. And of course, it also gives patients the option to change reproductive decisions during the pregnancy as well. And lastly, we can plan for the future. And that's really something that can happen in many different ways. For some families, if they are raising a child with a genetic condition, it may change their plans for things like daycare or financial planning. It also can help us plan for the future if it's done before pregnancy by giving us the option of in vitro fertilization or working with a fertility center to get pregnant. So this is just a handful of the pros and benefits of testing, but we know there are many that exist. With some of the benefits, we also have to be aware of the cons of testing. And for some patients, the idea that you could be positive for a condition is really concerning and quite scary. And sometimes patients know that they themselves would be quite anxious if they were found to be positive. And often, when they're working with either fertility or already pregnant, it's already a stressful time. And they may say, the idea of another test coming back that would really make me worry more is not something that I wish to pursue at this point. And that's completely acceptable and more than understandable. We've also touched on that there are limitations to screening and no screening is perfect. We can learn unexpected information. And at times, a family may have gone through multiple different tests, either with a fertility center or in a pregnancy themselves, and just really be burnt out from the process of testing and getting testing back and reviewing results. Or they might feel like it would be overwhelming to learn more information. And then lastly, a big concern or consideration for testing and potential con of testing is cost. Laboratories all vary in terms of what they bill for this testing. Oftentimes it is covered by insurance, but financial cost is just one piece of the puzzle. We've already mentioned that there are emotional cost potentials of this testing, like anxiety or stress, but there's also a time cost. This testing can take about 3 weeks to come back, potentially 6 weeks if we're also testing a partner. And that factor of time and potentially delaying prenatal decisions or reproductive decisions can be a really big factor to consider. And with those factors, again, I just highlight this. We've touched on most of these points already, but just a resource to go back to. When we're thinking about carrier screening, we do want to consider the cost, turnaround time. We want to make sure that it addresses all of our family history concerns. We should be aware of detection rates, and that is just a test's ability to pick up variants in a gene, which can vary from lab to lab. We also would consider panel size and make sure that the lab that is used for your testing is a certified laboratory for medical testing. And really, before someone does testing, there's many factors and questions that they may want to ask themselves. I won't go over all of these, but this will be available on the website like we mentioned earlier. But I think one of the most important decisions or questions to ask is this truly information that I want to learn at this time? And try to reflect on how this would make you feel if something was positive, not only for yourself, but for you and the biological partner that you are conceiving with. And then a few other kind of myths or misconceptions to keep in mind. Some people feel that they've done testing already. So we know that there are direct-to-consumer tests like 23andMe, which include testing for some of the common genetic carrier conditions and common variants. However, that testing has a much lower detection rate than testing that is ordered by a medical provider. And so it really does not replace the need for a larger carrier screening panel if you were to desire this testing. As we've mentioned, testing really has evolved over the years. So even if you had testing in your last pregnancy, it may still be reasonable to consider additional testing in the next pregnancy or before a new pregnancy. You of course do not need to do testing just because it was mentioned to you. It's always just an option, and you should never feel coerced into doing testing. If you have another family member that did this screening and had negative results, testing is still important for you because while we share about 50% of our DNA with our siblings, we are not a 100% match, and there is a chance that we could be the carrier of something that our sibling does not have. If you have a male reproductive partner that did testing in the past, it still is important for a female partner to do that screening or carrier testing because I mentioned briefly earlier, there are some conditions that can be passed down on the X chromosome just from the female. So it's still important to consider that option, even if your male partner had testing. And then one last misconception that we may hear more frequently is that carrier screening replaces the need for newborn screening. Newborn screening is offered to all babies born in Massachusetts and really all throughout the United States. It screens for about 60 conditions in Massachusetts. And these are conditions that, while often may overlap with things on carrier screening, because there are limitations to carrier screening, newborn screening still has its own unique utility and should not be declined just because someone did carrier screening. Then I just have a few more post-test considerations before we get into some questions. So after you get a test result back, you'll want to make sure that you ask the provider for copies of the report and to review the result with you in detail. And when you're reviewing that result, you'll want to ask about the symptoms that are associated with the condition, if there's different forms of the condition, how your variant impacts the chances of having a different form. And again, if there's any concerns for your own health and specialists that you should be connected to. If you and the biological partner are both carriers for the same condition, you have many different options that exist. If you're found to be a carrier couple during a pregnancy, there is the option to do an invasive or diagnostic procedure called an amnio or a CVS, which allows us to test a pregnancy and learn if they have the genetic condition, if the growing pregnancy is a carrier, or if it's completely unaffected. And depending on this result, this would allow us to connect you to resources if a child was predicted to be affected, or change your pregnancy plan based on the results. There's also the option, like we mentioned briefly earlier, to do postnatal testing. This can even be done by sampling the baby's cord blood without them needing any pokes after birth, which is really good news and something that families are normally excited to hear about. And then if you find out about your carrier status before a pregnancy, you also may have the option of doing in vitro fertilization or IVF, which allows an embryo to be created and then tested before even getting pregnant. And for some families, if they're found to be a carrier couple, they may consider other reproductive options like adoption or using a sperm or egg donor. One of the biggest resources I think for carrier couples to have is to try to connect with either a genetic counselor or a medical geneticist or really any specialist in the field of the condition that they screened positive for. These are all very unique conditions. And we can always help walk through all of these options with a couple if they are found to be a carrier. For more logistics, you may be wondering at this point, how do I get carrier screening offered or ordered if I am interested in this testing? Some providers may feel comfortable ordering this carrier screening themselves. And so in our practice, our OBGYNs and our reproductive endocrinologist team in the fertility department, they are very comfortable ordering this testing, especially if we don't have any specific family history concerns. If you are not currently seen by one of those groups, either our OBs or our reproductive endocrinologists, you can also connect with one of the genetic counselors on our team or throughout the hospital. Generally, that connection is facilitated by a referral from your primary care provider. And then before we wrap up, I just always plug some additional information to consider when you're planning pregnancies. And so when someone is pregnant, they have the option to do testing for those conditions that can happen at random. And that can be either through blood work or through diagnostic invasive procedures. They also always have options and are really encouraged to do ultrasounds, which are safe during pregnancy, to monitor for things that we can't always pick up with just blood work or just genetic screening alone. And for some families, there might be additional recommendations made by their OB team based on their own personal or family history. In summary, we know that there's many different types of carrier screening tests that exist and that are on the market for us today. And our protocols can vary depending by where you're seen. If you are interested in this testing though, you should advocate for yourself to get this screening and talk to your provider about how the best practice or best way to get that test ordered is. Screening is the right option for some families, but it's not the right option for everyone. And it's important to consider how you feel or would expect to feel after doing this testing. Preconception testing allows for the most reproductive options because we have the ability to do things like IVF. But again, it's not the only time that you can do this screening. And at many points in your reproductive journey, it may be useful for you. And overall, we really do encourage a discussion with your provider about all of these options. So as we wrap up and get into questions, and as Amy rejoins, I just wanted to thank the Blum Center along with my colleagues at MGH and our specific genetic counseling team. And then you can always take a screenshot or connect to a reproductive genetic counselor at the number below.
Thank you so much, Kelsey. We are now at the end of the session, so if you have any questions, feel free to enter them in the chat. We have a question regarding ordering carrier screening. Can primary care doctors order them, or does it have to be done through a genetic counselor?
Yeah, great question. We touched on that a little bit at the end. To a degree, it can vary. And some of that is based on what your primary care provider is comfortable with and what connections they may have or their personal knowledge about genetic testing. They, I would say, are a really good place for you to start and at least start the conversation and ask questions about what their protocols and policies are. If they are not comfortable ordering this testing, or if you would prefer speaking with a genetic counselor, that's a good time to get a referral placed over to someone on our team or the Genomic Center, because they also have genetic counselors that can help order carrier screening for maybe individuals that are more low risk without a real family history concern.
Thank you. And generally, do both parents need to complete the screening?
Yeah, that's also something that can vary. And I think there's many factors that we consider with that protocol. For most of our patients, we start by doing screening for the female member of the couple because of those X-linked conditions. Sometimes that can also help to reduce potential costs, depending on insurance coverage and things of that nature. I would say it is sometimes useful for both members of a couple to do that testing at the same time, especially if we have specific time constraints. So if someone is maybe a bit later along in their pregnancy and wants information sooner, it may be helpful for us to do testing for both the male and female at the same time. Generally, this testing takes about 3 weeks to get back, and so that's a factor that we do consider as well when we're planning this testing.
Thank you. For those who are currently pregnant, can you walk us through the process on what to generally expect when seeing a genetic counselor for carrier screening?
Yeah. So for individuals that are currently pregnant, that can vary depending on, again, institution and your provider's preferences. At Mass General, if your OB is one of our providers, our nurses are very familiar with carrier screening, and they will ask you very specific and targeted questions on one of your very first intake calls. So that normally happens around 8 to 10 weeks of a pregnancy. You'll have a phone call with your nurse, and they'll give you lots of different information. They'll also ask you many questions about things like your family history and those specific things that I mentioned earlier. If an individual has a family history that is a bit more concerning, that's typically when you're directed to meet with one of my colleagues or myself to discuss if we want to do or would recommend a larger panel. At Mass General, we're currently recommending or offering a 176 gene panel for all of our patients. And if you don't have a family history specific concern, that's something that your nurse or your OB is typically able to discuss with you in a great amount of detail. And then at Mass General, when we think about getting the results back, 3 weeks after you do that blood work or testing, if you're positive for something, we have an assistant that normally sends a message to you, giving you directions about locating your test results, learning more about the condition that you're a carrier of, and organizing testing for your partner. There are some situations where we would call you to review the results again if you were a carrier of something that was X-linked, or if you had specific questions, a member of our team is always available.
Thank you, that was helpful.
Yeah.
You briefly touched upon Genetics Information Non-Discrimination Act. Can you discuss a little bit more about that?
Yeah. In general, when we think of the Genetics Information Non-Discrimination Act, it's really useful in protecting individuals that have a genetic condition themselves. And so for the most part, individuals that are found to be a carrier of a genetic condition really don't need to worry about that act because they wouldn't have symptoms that would impact their own health. But in the rare case that you are found to have a condition on carrier screening, or again, if it was a condition that you could have some degree of symptoms for, there are protections in place for most employers. There are some stipulations. I believe you have to be working for a company with either over 15 or 30 members on the team. It does not necessarily apply to members of our military in the United States, but it protects any discrimination, such as like a loss of job based on your test results or genetic diagnosis. It also protects against additional charges or being denied health insurance based on the test results, but it doesn't necessarily protect against things like long-term care insurance discrimination or being denied coverage or being charged more through life insurance. So there are still limitations to the GENE Act.
Thank you.
Yeah,
Are there any online resources you recommend for someone interested in learning more about it?
definitely.
Carrier screening in general.
Yes. Yeah, so there are multiple different committee opinions. I reference here the American College of Obstetrics and Gynecology, and their most recent publications were back in 2017, but they have been reaffirmed in 2023. There's also, again, the specific Genetic Information Non-Discrimination Act that people can read in detail. And then the National Society of Genetic Counselors has this useful resource which is found if you either search the National Society of Genetic Counselors and Understanding Genetic Carrier Screening, or if you are able to take a screenshot and just click this link.
Thank you. I'm also going to enter that link in the chat for anyone interested. So I don't see any further questions. Before we end today's session, Kelsey, do you have any final thoughts you'd like to share with the audience?
No, thank you again for the chance to present, and hopefully we'll be able to see some of these individuals in our clinic to learn more if you have really specific questions or would like the opportunity to meet with one of us.
Thank you, Kelsey. And for everyone who joined us today, thank you so much for taking the time to join us. As I had mentioned, today's program is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you, everyone. Take care.
Thank you.